Hi, I'm Ann. I'm a Zejula patient ambassador. I am a natural athlete and I love sports in general. I love playing volleyball, soccer, softball, and so I thought golf would be like a little on the boring side. However, it's a wonderful game because it's you against yourself. And so you really need to learn to have patience and you learn to really kind of just relax. And each time you play, you just learn a little bit more about yourself. So Clay is the love of my life. He is my split apart, and we actually met, golly, almost 31 years ago. He is my soulmate. He's my best friend, and I'll get emotional about it, but he is the love of my life. Clay and I have 5 kids, and they are the apple of my eye, and the reason that I fight so hard to be here. So, in February of 2015, I am postmenopausal. It's just part of growing up. And I was experiencing a little spotting. And so I went immediately to the doctor to get checked out. They did an ultrasound and said everything was great. My ovaries were fine. Fast forward to April, and it was April 7th, and I was out on a Tuesday evening, and I started having excruciating pain in my lower left side. Clay immediately took me to the closest emergency room. Once we got back there, we talked about what had happened, and this time they gave me oral contrast. So usually when you have anything in your abdomen, the only way that they're gonna see it is through drinking oral contrast and then the dye. And the doctor, and I'm gonna get emotional about this, but the doctor actually was our doctor he was our primary care. And so for him, it was particularly difficult. And he leaned over and he said, "Your abdomen is flooded with cancer." And Clay and I looked at each other, and it was like, you must be mistaken. You might be mixing me up with somebody else. There's just no way that I have cancer. It was shocking. I mean, I have 5 kids, I'm slender, I eat clean, I don't smoke, I don't drink. You know, how is this possible? And so we had to wrap our heads around that. You know, I'm not ready to die. I have a lot of living left to do. So the next thing we were told was that in 3 weeks, I was to come back and have this surgery done, and then they'd start chemo. So it was 6 weeks post-surgery, and the chemo started. You know, it's such a dark time. I spent months on the sofa in our living room, not being able to move. My body had atrophied, you know, so now when I have little muscles, I'm like so excited about it, you know, and that's from loving on all those grandbabies and picking them up and holding them.
To be honest, my memories of that time are us laying on the bathroom floor as she can't be anywhere but in the bathroom for one reason or another, but just laying on the floor with her all night long and holding her and trying to be there for her and, you know, trying to get through trying to get through that moment as best we could.
July 11th, which is my daughter Katie's birthday, is when I was deemed no evidence of disease, because the chemo and the surgery, every time they did this lab test called a CA-125 that tells you how much cancer is in your body, they did a CA-125 and a CT scan, and they didn't see any cancer. We had gone out to a big kind of all-day music fest, and they call it Dancing in the Streets. The year prior, I was dancing in the streets. This time, I just didn't feel like dancing, which was really pretty disconcerting. So we kind of just walked around a little bit, and then I started having pain again in my lower back. And I had a scheduled CT scan and a scheduled lab follow-up. So within 4 hours from having the CT scan, the oncologist office called me, said, "We need to see you." which is a giveaway right there. And the CT scan showed that once again the abdomen was flooded with cancer. And quite frankly, I was more devastated the second time than the first time. They couldn't use the same chemo they'd used previously because it was deemed really not to be effective. And so this second round was harder because A, I'd never been through it before, and B, he had to use a whole different chemo agent. I've finished up 9 months of chemo, and Clay had been doing some research. He was always researching. So he had discovered that the FDA had approved a brand new treatment that had been under clinical trial for 2 years called niraparib, but also referred to as Zejula, which was phenomenal. So I said, go. I mean, let's do it. And I started taking Zejula, and I was the first patient at that hospital in Jacksonville who had ever been given this drug. So when I first started out, I was put on 300 milligrams, which is what everybody is put on. And what we found was that it was too much. My neutrophil levels were dropping, and they said if they didn't come back up in 28 days, that I was no longer going to be able to take this drug. But they could not figure out how 2 days before the 28-day mark, my neutrophil levels skyrocketed. I mean, they went right through the bottom of the bottom to above and beyond. And I always say it's a grandparent or grandbaby love, but I got back up. They switched me down to 200 milligrams to see how I did on that. So I've been on 100 milligrams now, and I just met with my doctor last week, had another CT scan, no evidence of disease. My labs are terrific, and they're over the moon because I am a success story using this medication. I was able to go back to work, but for me, it has done exactly what they had hoped it would do, which of course has made me extremely grateful. Very many people are private about this sort of thing, but I feel like if I can help one person by telling my story, then I've done something good with this experience.
So my advice to other care partners would be just to, as best you can, support your loved one as they're dealing with this very difficult disease and treatment regimen. And also, to remember to take care of yourself so that you can be there to the best of your ability for the person you love.
So, I previously knew the word gratitude. It's something that is discussed a lot in our home, being grateful for the gifts that we've been given and not taking them for granted. Having been diagnosed with cancer, relationships became much more important. Things before maybe were measured by the amount of your paycheck or what your home looked like or whatever. It has nothing to do with that. It's really the importance of connection. And so my gratitude, it overflows. When my oncologist said, go back to work, no longer was I living in disease. I was living life again. And my focus wasn't specifically about battling the cancer. It was about living life large. For today, my feet are planted where I sit. And, I'm just grateful for this day.
Important safety information. Zejula may cause serious side effects, including bone marrow problems called myelodysplastic syndrome, MDS, or a type of blood cancer called acute myeloid leukemia, AML. Some people who have ovarian cancer and who have received previous treatment with chemotherapy or certain other medicines for their cancer have developed MDS or AML during treatment with Zejula. MDS or AML may lead to death. Symptoms of low blood cell counts, low red blood cells, low white blood cells, and low platelets are common during treatment with Zejula. But they can be a sign of serious bone marrow problems, including MDS or AML. These symptoms may include the following: weakness, feeling tired, weight loss, frequent infections, fever, shortness of breath, blood in urine or stool, bruising or bleeding more easily. Your doctor will do blood tests to check your blood cell counts before treatment with Zejula. You will be tested weekly for the first month of treatment with Zejula, monthly for the next 11 months of treatment, and from time to time afterward. High blood pressure is common during treatment with Zejula, and it can become serious. Your doctor will check your blood pressure and heart rate monthly for the first year during your treatment with Zejula, and as needed afterward. Your doctor may lower the dose of Zejula to treat high blood pressure. Before starting to take Zejula, tell your doctor about all of your medical conditions, including if you have heart problems, have high blood pressure, are pregnant or plan to become pregnant. Zejula may harm an unborn baby and may cause loss of pregnancy, miscarriage. If you are able to become pregnant, you should use effective birth control, contraception, during treatment with Zejula and for 6 months after taking the last dose of Zejula. If you are able to become pregnant, your doctor may perform a pregnancy test before you start treatment with Zejula. You should tell your doctor right away if you become pregnant, are breastfeeding or plan to breastfeed. Zejula may harm your baby. You should not breastfeed your baby during treatment with Zejula and for 1 month after taking the last dose of Zejula. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Zejula include the following: heart not beating regularly, nausea, constipation, vomiting, pain in the stomach area, mouth sores, diarrhea, indigestion or heartburn, dry mouth, tiredness, loss of appetite, urinary tract infection, shortness of breath, cough, rash, change in liver function blood tests, pain in your joints, muscles, and back, headache, dizziness, change in the way food tastes, trouble sleeping, anxiety, sore throat. If you have certain side effects, then your doctor may change your dose of Zejula, temporarily stop your treatment with Zejula, or permanently stop treatment with Zejula. These are not all the possible side effects of Zejula. For more information, ask your doctor or pharmacist. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information.